Dear students, welcome to this academic session. This session is titled as Anxiety Disorders. I would like to welcome all of you to this particular session, which is conducted by B.R. Ambedkar Open University. This particular topic, anxiety disorders, is integral part of UG second year 4th semester. Hence, for the next 30 minutes, dear students, I would request you to pay attention to what I am going to talk. The purpose of this particular session is to give you conceptual clarity about anxiety disorders. And secondly, note that this session is not going to equip you to diagnose disorders. This session is meant only to develop a broad understanding as to what it means by anxiety disorders. Let me tell you, anxiety exists in a spectrum. Anxiety doesn't exist in isolation. When we talk about the fact that anxiety exists in spectrum, anxiety is a normal emotion, it's an adaptive emotion. That means all of us go through anxiety. Children, men, women, aged people, middle-aged people, across all ages, people go through anxiety. It is a normal anxiety. Whereas, this anxiety can be seen at the other end of the spectrum also, wherein people generally get so preoccupied with the nature of the symptoms that they have. Let us systematically examine what is the kind of anxiety that normal people will go through. What does it exactly mean by anxiety disorders? Now, I have already mentioned that it is a very natural emotion. Generally, anxiety is triggered by identifiable realistic stress. Like, imagine that you are going and taking an exam. You are attending an interview, you have a deadline to catch up, your health results have come once you go for a diagnostics and you have to face an interview. These are all triggers. When you go through this, some amount of anxiety sets in, which is a very normal anxiety. For many of us, this anxiety is very common. And let me also tell you that this anxiety helps us to prepare the body for action, either fight or flight response we get into. It's going to be very short term, short lived, and once the activity gets over, this anxiety also calms down, it dies down naturally. Whereas, when you are looking at anxiety disorders, the other end of the spectrum, anxiety becomes excessive. It will be there with a person for a very long time, and they may find it difficult to identify a clear trigger for the kind of anxiety they go through. Okay, the emotion loses its adaptive value and becomes maladaptive. So, once a person gets into this anxiety disorder spectrum, okay, it will become maladaptive, they become dysfunctional. Okay, it often arises out of the blue, out of no reason. It appears that people are suffering from anxiety disorder. Now, let me tell you intensity and duration between normal people who undergo anxiety and other people who have anxiety disorders. Now, for many of us, it's mild to moderate in terms of intensity. It lasts for minutes, or for some people a couple of hours and all that. It doesn't linger for a very long time beyond the stressful life event. Whereas when it comes to anxiety disorders, very intense, very sharp. It is disproportionate fear or worry, in the sense that the moment they see a trigger, they have an exaggerated sense of worry. It lasts for weeks, sometimes months, sometimes it can also be very chronic. And it is often difficult for the person to control this particular anxiety. That's the reason why they seek the help of a psychologist, they seek the help of a mental health professional or a psychiatrist when they undergo anxiety disorders per se. Now, let's look at what are the symptoms look like. So, you can classify these symptoms in terms of physical symptoms, cognitive symptoms and emotional symptoms. Let me tell you what are the physical symptoms. For normal people, some amount of sweating when they feel very anxious and heartbeat goes up. Okay, it occurs in the context of whenever there is a stress. And what are the kinds of cognitive symptoms? So, they feel worried, okay, they have that worried well, and they experience butterflies, some kind of confusion. And what are the emotional symptoms? They have nervousness, some kind of trembling, and they are apprehensive as to what is going to happen. Whereas when it comes to anxiety disorders, it's not that they have just sweating of palms and fast heartbeat, but they have reaction. A small symptom is different from that of a body exhibiting reaction. What is it? Palpitations. Heartbeat goes up, goes down, goes up, goes down. It doesn't stop. It keeps going on as if you get an apprehension that something is going to happen. And their hands keep trembling and they have dizziness. Sometimes they have breathlessness without any identifiable cause. They feel that they are not able to breathe in. And what are the cognitive symptoms? They have catastrophic thoughts. That means something horrible is going to happen to them and something terrible will happen, and they think that I'm going to collapse. Indeed, they won't collapse, but they feel and they assume that they're going to collapse and they're going to die, or something is going to happen to them, and they will generally lose control. What are the emotional symptoms? It's very intense fear. It's not small kind of fear. It's intense. It troubles them. They feel very dreadful about the entire thing. They are hypervigilance. Hypervigilance means what? Vigilance means being observant of what is happening in the body. They keep perceiving their own heartbeat, racing of heartbeat. They keep perceiving the excessive sweat that they have. So, when you have this kind of symptoms, you call that you have anxiety disorder. And another dimension is, I am also going to talk about what kind of impairment you can see in people when they suffer from anxiety. Now, on one hand, you have normal individuals, normal people who undergo anxiety. Okay, it does not significantly interfere with their daily functioning. So, they live with that. They are okay having that kind of anxiety. The person can still work, they can study, they can carry out their day-to-day routine activities, they can socialize, they also carry on in a very, very normal way. You can't really make out that they are suffering from anxiety state. Whereas some people who have this disorder, they are marked, they have a very marked impairment in work. So, you can see that there is some problem with this person. There is some issue with this person. There is some concern with this person. He is not like anybody else. That's the kind of ideas you get. Okay? It's marked impairment in work, relationships, sleep, their concentration differs, their daily functioning is also altered. Okay? They keep avoiding situations, avoiding people, and this avoidance becomes pretty habitual. Okay? They avoid places, they avoid people, situations. Why do they avoid? Because they get exposed to any of these things, they have anxiety. That's the reason why they have reduction in, to reduce the anxiety on their own, what they do is they avoid this kind of places, people and situations. Now, let's see what it means by control over symptoms. You, me and many others, they have who have normal anxiety, the person can calm themselves. Okay, they tell themselves, okay, cool down, nothing is going to happen. Okay, so we are in control of our own emotions, and subsequent to that, they can relax well, they can cope well, they get into deep breathing, they breathe in and breathe out, they change their thoughts. Okay, it's natural, it's very common, nothing is going to happen. Okay, so they talk to themselves. This is often called self instructional training. Whereas some people, on the other hand, who suffer, rather who undergo this kind of anxiety disorders, their feelings are intrusive. These ideas, these thoughts keep coming to them. Okay, and they find it difficult to control them. They make an attempt, but they can't control them. It becomes, the moment they try to control them, it becomes pretty excessive. They attempt to manage anxiety, but they may fail, and it may even worsen as well. It is often accompanied by avoiding things, and they always seek reassurance. Am I okay? Am I fine? Am I behaving well? Okay, so they expect you're fine, and you're okay, and nothing is wrong with you kind of behavior from others. So, which means that gives safety to them. Now, let's look at frequency and predictability. People who experience anxiety in a very normal way, it occurs occasionally. It's not that everyday phenomena. Okay, occasionally, whenever there is a stress, or whenever there is a situation, whenever there is a threatening person before them, superior person before them, like boss, okay, they experience that. It is so you can directly discern the stress root for that, for this particular anxiety. Whereas, if you look at people who suffer from anxiety disorder, it occurs very frequently and it's very unpredictable. You cannot make out when this is happening. It may happen even without any stressor also. There may not be much of a stress. Now, let us also look at, there is one important thing that I am introducing to you, that is called diagnostic criteria. See, when all of us go to doctors listen to our complaints, listen to our symptoms, and they give a diagnosis. Similarly, in psychological disorders also, diagnosis is a very important entity. People who suffer from normal anxiety, rather people who have normal anxiety, they do not have any clinical condition. It is normal for them, and it's okay to have that. It doesn't qualify for a clinical criteria, for a diagnostic criteria. Remember, there are two things. Let me introduce two words to you. One is called DSM, the other one is called ICD. DSM is called Diagnostic Statistical Manual, whereas ICD is called International Classification of Diseases. Now, DSM has been proposed by American Association, whereas ICD has been proposed by World Health Organization. Now, they come up with certain classification of disorders, and they say that if a person has these many symptoms, these many number of weeks, these many number of months, we can give them, we can give this kind of disorder classification. So, in normal anxiety, you don't have a diagnostic statistical manual and international classification of diseases entity. Whereas anxiety disorders, it has several conditions. Okay, there are quite a few conditions that have been notified. One is called generalized anxiety disorder, panic disorder, social anxiety disorder, specific phobias, agoraphobia, separation anxiety disorder. Each and every disorder of this, they have certain symptoms, level of severity, level of impairment. You have to understand that. It's like this: if you get hurt, you might be suffering from mild hurt, moderate hurt, severe hurt. You might be having mild pain, moderate pain, severe pain. Like mild, moderate, severe, as how these three words describe your pain and your hurt, these particular disorders also can be classified as a person having mild symptoms, moderate symptoms and severe symptoms. Now, that is one aspect. Now, does this really impact the quality of life, the way you live, how well you are living, how satisfied you are, how comfortable you are? See, people who have this kind of normal anxiety, they have a temporary discomfort and there are no long term negative consequences. They experience little bit of distress at that point of time. It's not they experience distress for a greater length of time. Whereas people who have anxiety disorders, which I have mentioned earlier, like generalized anxiety disorder, panic disorder, phobic disorder, etc. Though when people experience those disorders, it can lead to depression. It can also lead to substance use. It can lead to sleep disorders and physical health complications. Some people experience hypertension and chronic, they feel very aroused and they feel unmanageable, they find it difficult to handle themselves. So, people who experience problems because of anxiety disorders, it impacts their quality of life as well. Now, this is a very important information. I would like to request all of you to pay attention to this. So, now what is it we have examined, what is it we have studied? We have looked at precisely, I told all of you that anxiety is a normal emotion, it is an adaptive emotion and it is common for a lot of individuals to have anxiety. Okay. Now, we are moving away from that. I also mentioned that there are people who experience difficulties, discomfort, disturbance because of the kind of severe anxiety they have and they are subjected to anxiety disorders. That is what I said so far, and now we will talk about anxiety disorders per se. Now, there are group of disorders. I did mention when I started this session that anxiety exists in a continuum. What are these group of disorders? Okay, group of clinical conditions. Now they become disorder when the anxiety is disproportionate to the situation. So, something small thing happens, I keep crying excessively, I keep behaving in a very dramatic way as if something very big has happened. Indeed, something very small has happened. It is very difficult to control and it persists for months and causes functional impairment in social and occupational functioning. For students, some of you students like, okay, it can also impact your academic area. Now, it impacts, there are a lot of causes for this: biological, psychological, environmental. There is a genetic loading also and temperament issues. There are a lot of issues that have been discussed for anxiety disorders. So, if you have excessive fear and if you have persistent anxiety, as a result of that, if you have a behavioral disturbance and if you avoid things, people, situations, if you have hyperarousal and if you have lot of physiological symptoms like palpitations, breathlessness, difficulties, restlessness, excessive sweating, then we can say that these are all integral part of anxiety disorders. See, predominantly I have already mentioned about DSM and ICD. If you look at that, there are 7 kinds of disorders which have been identified: generalized anxiety disorder, panic disorder, agoraphobia, specific phobia, social anxiety disorder, separation anxiety disorder, selective mutism. For a very long time, obsessive compulsive disorder also has been included in anxiety disorders, but in the recent past They are not including obsessive compulsive disorder as integral part of anxiety disorder. They started saying that it is a different spectrum disorder. It is a different entity altogether. Now, let us look at each of these disorders. I have some case slides also, but due to paucity of time, I am just giving you only these. How does it look like? Now, if you look at generalized anxiety disorder, it's people have, it's very excessive. Okay, people have uncontrollable worry, which means they find it difficult to stop. Worry about what? About many things, about multiple domains of life. It can be health, it can be finance, it can be work, it can be family, it can be what is going to happen in future. This worry occurs many days. If it is there for about 6 months or little greater than 6 months, consistently, they qualify for the criteria of GAD. It is often accompanied by at least 3 symptoms. 1, restlessness. That means feeling keyed up always, fatigue, irritability, and they have difficulty in concentrating as well. And they also experience a lot of muscle tension in the body. They also have sleep disturbances as well, which means they have free floating anxiety. It's broad, it's not tied up to specific event. In general, they feel very anxious, they feel very disturbed, they feel uncomfortable. But if you ask them, why do you feel uncomfortable? Why is it this kind of disturbance is there? They find it difficult to tell you. They find it difficult to explain. Now, let me explain about this panic disorder. What are the characteristics, features of panic disorder? So, they have recurrent, unexpected panic attacks, like sudden surge and intense fear, irrational fear sometimes. They peak within minutes. In a short span of time, panic attack occurs to them. It includes you are not able to stop your heartbeat. You perceive that something is happening to your heart, okay, and your heartbeat goes up and it doesn't stop. And breathlessness, you feel that as if you are not able to you are not able to breathe in properly and something is happening to you, and you experience trembling sensation. You also experience chest pain, fear of losing control. Let me tell you, people who experience this panic attack, generally they think that there is a problem with their heart related problem. They keep visiting cardiologists several times. By the time they come to psychologists, they have a huge file, and it is very clear that quite a few of them have panic disorder. Persistent concern about, they are always worried, when is the next attack going to come? When am I going to experience the same thing? And am I going to get this kind of thing when I'm writing the exam? So all such kind of thoughts keep coming to them, and maladaptive behavior change, avoidance of See, such people, they take excessive care of themselves. They don't travel, okay, they avoid crowded places, and they don't get into any activity which creates exertion to them, because they anticipate this kind of panic attack. And now, let me talk to you about agoraphobia. First of all, let me tell you what it means by phobias. Phobias are irrational fears. Okay. Specifically with reference to agoraphobia, it's a fear of situation where escape might be difficult or help unavailable. If I am sitting here, it's a closed room. If I perceive that if something happens here in the room, I am not able to run away from the room, my phobic reaction gets exacerbated. Sometimes people commonly fear a few places. One is called public transport. Second one, very open places. If you go and if you get lost in a huge ground, there will be a problem. You get so worried. Enclosed spaces, crowds, being alone outside the home. It also leads to avoidance. In severe cases, person becomes housebound. Anxiety is out of proportion to actual danger. So, there is danger, they perceive danger, and the danger that is being perceived is out of proportion. And let me focus about specific phobia. Specific phobia. So, some people have phobias, rather irrational fears about specificity, about an object or a situation, about dogs, about animals, about heights, about flying, about injections, about blood, about storms. So, it trigger almost always provokes immediate fear. Avoided or endured with intense distress. Fear is disproportionate and persistent like in the earlier disorder as well. Person recognizes irrationality but feels unable to control it. Now, social anxiety disorder, what are the features? This is often called as social phobia, and intense fear of being scrutinized, judged, or embarrassed in social or performance situations. So, they feel that others are examining them, others are evaluating them, others are judging them, others give marks to them, they rate them. So, what are the commonly feared situations here? They find it very difficult to get into public speaking. Have you seen that? I am sure that many of you or some of you might be having this. If I ask one of you spontaneously to come and address a gathering, your heartbeat goes up, you find it difficult, and there may be a lot of problems. Some people have difficulty in meeting new people, and some people also, it has been observed, eating in public and being observed, that is also one of the common problem. So, it interferes with academics, with work, it interferes with personal well-being. If it is persistent in a person for more than 6 months, okay, it is a cause of concern, we have to address it. And separation anxiety disorder is another thing. So, we often see some kids, they find it difficult to go to school because they have to stay away from mother, stay away from home, stay away from commonly adjusted environment, excessive fear when separated from attachment figures. Like, who are the attachment figure? Father, mother, okay, grandfather, grandmother. So, when they are asked to go to school, they experience distress at separation, worry about losing the attachment figure, reluctance to be alone. They find it very difficult to be alone. And lastly, selective mutism is another disorder. Okay. People who experience this problem, the consistent failure to speak in social situations while speaking is expected, school, public places, despite speaking normally in other situations. Okay. So, in all situations they are fine, but in certain situations they mute themselves, interferes with education. See, have you seen some people, they keep talking a lot, but whenever teacher asks a question, they keep quiet. It is like selective mutism. Okay. It is, if it is consistent for a good length of time, which is not limited to first month of the school and all that, okay, not due to language or knowledge deficits at all. So, these are some of the things that I brought forth to all of you. So, what is it we have done? To sum up, we have looked at the fact that anxiety exists in a spectrum, number one. Number two, there is all people undergo anxiety, men, women, across all ages, and there is a subtle distinction between anxiety, common anxiety and anxiety disorders. And I have identified several anxiety disorders. I told you when people suffer from these anxiety disorders, what kind of symptoms they display. With this information, probably you can go back and you can refer your material and you can update yourself. Thank you very much.